Hi guys, I'm Jared Naylor and this is Partially Impartial. We're seeing more of the same as we continue trundling down this path of COVID and economic limbo. We seem to be at somewhat of a critical point as we watch the death rate slowly climb upward and we see the end date for the unemployment benefits creep closer and closer. We really appreciate anyone who has decided to check out our new channel and especially those who support us through likes and subscriptions. We'll quickly run through some of the COVID numbers and give our audience an update on that. And then we'll go ahead and jump over to a few key articles that we found. So with that being said, I'm joined by CJ and Sheldon today. So thanks for chatting with me, guys.
Glad to be here, everybody.
Yeah, of course, man.
All right, so we'll jump right over to the numbers here. We're definitely still seeing quite a bit of an uptick here in the US and across the world. As of recently, we've been breaking some records here in the US. The highest I've seen, because it seems like every source I see gives a little bit of a different number. The highest one article I've seen said we broke 77,000 new cases in one day. And, and we're seeing over 60,000 every day now. So it seems like what Fauci said a couple weeks ago that we may reach that 100,000 a day number. That does seem to be getting truer and truer as we go along here. So looking at the USA numbers here, we're seeing around 700, 800 deaths per day. And like we said on last show, that does seem to be reversing now. We seem to have hit the bottom and now we're heading up and up as we go. So let me look at this, the death charts here. Yeah, so we bottomed out about 600 deaths per day, and last week we had a 993 was the highest we had last week, and this week we broke 1,000 again. So this is the first time we've had over 1,000 deaths in one day since all the way back in June 9th. So yeah, we're definitely seeing that trend reverse. Yeah, Florida, I'd say, is probably the biggest hotspot right now. They got over 15,000 cases one day, which is actually the national record. So they got more cases than New York was getting back when things were really hot. But of course, that was before testing had really ramped up. So more than likely, that New York was actually getting more cases, even though we just didn't have the testing to show that. And so we're kind of seeing the same things in Texas, Arizona, Georgia, California, Florida. Even here in Utah, we're seeing, we're kind of keeping up to pace with all of the southwestern states that seem to be getting hit the hardest now. Just so anyone in Utah listening, we're seeing over 600 cases most days now. Just yesterday we had 785, and that's up from about the 150 per day we were seeing back when the economy was closed, and even shortly after we opened the economy, we were still seeing under 200 per day. So I think people kind of got complacent here in Utah and in some of these other more Republican states, and now we're paying for it because they never really learned the lesson the hard way.
Yeah, I just don't understand why Trump would want to do that. Why would he want to take away the CDC, the place that has the people that are actual experts on this, or experts in their field, maybe not on corona, but showing these numbers, and he's like, "Oh, we can do it better." Like, I don't get it. Doesn't make any sense.
Yeah, I have an article here about that actually, so we'll touch on that a little later too. Definitely raises some questions. That's something I've kind of wondered as well. I mean, really, the only logical reason why he would be pulling the hospital data from the public would be because it looks really bad. That's I don't really see any other conclusion that you can arrive at. But maybe we'll jump here over to that article. So it says here, the Trump administration just pulled coronavirus data out of the CDC's hands, and it means Americans can't see where hospital beds are filled. So, that just going off that, it almost seems like a lot of these hospitals that are reporting that they're really full, and it's like headline news every day, and Americans are just seeing that. And I guess it's probably because that's probably the one thing that's actually bad, because if you just look at the cases, 70,000 per day, it's really really easy for someone to write that off and say, well, 70,000, but the deaths aren't that high, so really the more cases we get, it almost shows that it's not very dangerous. But then you see the hospital data, and it's really hard for people to shrug this off and make it seem like we're handling this correctly when the hospitals are reporting all of this bad data. So taking that away from the public, it seems like it's kind of just an attempt to make it seem like things are going better than they are.
Yeah, I don't think it's a good idea to be living in a false sense of security and reality, in any way, shape, or form, because I think that's the number one thing that Trump has done wrong this whole time with the virus is downplay it. All he's wanted to do is downplay it. And jokingly, I had a friend share I don't know if it was jokingly or somewhat serious, or if it was real, but he shared a map of the world, and it had the number of countries that the U.S. can travel to right now. U.S. citizens can travel right now, and I think the only green countries were Turkey, Madagascar, and that was it. I don't know if that's true or not, but I mean, it's like, we're really hurting ourselves and hurting the people, like that part of like the economy of travel and things like that. I mean, tourism is a big industry, and I mean it's been hurt significantly already due to the fact of coronavirus, but we're only making things last longer and hurt longer by people thinking that this is something not to take seriously.
Yeah, and just going back to the false data that you said there, and this kind of just goes right into that. This in pulling that data, it just seems like as a nation and many other nations across the world are doing this same thing too, where they just falsify the data to make it look like what they need it to look like, and then in a sense that can be somewhat of a self-fulfilling prophecy. I know, especially when it comes to the economy, if you like with the jobs reports that we've been getting lately, they're completely manipulated, completely faked, but yet it doesn't matter because the algorithms that read the headlines, they're waiting to buy stocks as soon as the news comes out because they want to be the first one in. They just look at the number, unemployment down to 11%. I believe we were like up to 15% or so, the official U3 unemployment, which is already kind of fake in and of itself. But not only are we using the fake U3 number, which Trump himself talked shit on before he got into office. Not only are we using that, but now we're also faking that number even more. Like in the footnotes of the recent jobs reports, it says like, oh, by the way, 3 million Americans were classified as employed when they weren't actually employed. It's that type of thing. But it doesn't really, with economic things at least, you can almost get away with it because what he wants is the stock market to go up. What he wants is more money piling into that. And so if you give him the bad fake data, and they react as if it's true, then it makes the stock market go up. And so it's like it kind of just makes it happen on its own. But with the health stuff, that just seems, it's not like you can put out all this bad health data and it's actually going to make things better. It's going to actually make things much worse.
I don't know. Trump seems to have a stick up his ass about China. And doing what he's doing right now, it's like he called up the Chinese president who's like, hey, I'm just really curious. What did you guys do to make it seem like it really wasn't that bad? And now he's doing exactly what they were doing in his own way of, I'm right, I'm important, I'm in charge, everything's going to be okay. I'm going to report numbers. I know numbers. There's lots of them. I've worked with them. Numbers are good. I know them. It's just like just it irritates the hell out of me because he's literally doing like as you were talking about the way that he's handling it. It's like we always thought that China was fudging their numbers. What is Trump doing now? Fudging the numbers, and it just
So no, that's what I was with what you were saying, Sheldon. It's kind of just interesting with the way that Russia just got caught hacking our vaccine trials and kind of setting us back, because now it's this like rush to who's going to get the vaccine first and like who's going to have a cure first. And it's just like, I don't know, it's really interesting because then it's just like, okay, like China could be the one that had the virus first, or maybe Russia had something to do with it, or maybe they're just using it to their advantage now. It's just like in their own sense, like, cool, we could sabotage America and screw them up right now while they already have a dumbass president, and in return, like we're gonna set them up for failure.
yeah. I guess kind of diving into the idea of some of these things too. It's kind of interesting to think that what if we look back 50 years from now and we recognize that 2020 was the year that the world got hit by the largest biological warfare ever seen. What what if in the future we find out that this whole thing was set out to do exactly what it did, and it worked, but everybody thought that it was just a virus that came to be, however it came to be, and now and then we find out that it was just biological warfare from whatever country it might be. Hell, it could be Madagascar.
Definitely could be a weapon of some kind. I think a lot of the evidence that I've seen, at least, shows that it probably was likely tampered with in that Wuhan lab and then released, whether on accident or on purpose. But getting to the bottom of that truth, the way I see it, probably it's going to go down in the history books, kind of like 9/11 or Pearl Harbor or whatever. Like, there's going to be the official narrative of what happened, and then that's just going to be the real narrative. I don't know how countries get away with things so big like that, but it seems like if you look back in human history, definitely there's been a lot of false flags, and if you're on the winning side, then you kind of get to write that however you want it to be written.
Yeah, and that's the thing. I mean, you basically get to all these countries write their own history books, like and in a sense, like the Germans probably right that they ended up winning the war, or ended up backing down very nicely or something like that. Like it's just, I don't know. I'm sure it's all manipulated per country.
That's true. There probably is some of that. So coming back to these numbers, there's a couple other things I wanted to touch on before we jump over to these other articles. But this number here that we've talked about a lot in past shows, especially our earlier shows, the death rate of closed cases, that was up around 15% when we were first starting, and we're actually now seeing that come down and down and down, just like what we were predicting. And it's down to 7% right now. So out of the 9.3 million cases that we've discovered and then they have been closed, 93% of them have been considered recovered, and still 7% of those have resulted in death. So that's still pretty significant. And then, of course, like we've talked about in other shows, there's the whole factor of what does it really mean to be recovered. And I'll jump to an article on that here in 1 second, but I did want to say a couple things I noticed. Some of these countries are actually seeing some pretty big numbers now, which is probably the result of increased testing. So India, they actually had 40,000 cases. That's today on a Sunday. I don't know if it all works the same there, but normally numbers are down on Sundays. But I think that's the highest I've seen from India lately. So they're probably really ramping up their testing. I mean, it makes sense that they're probably getting over 100,000 a day, just given the Indian culture and how many people there are in general. So yeah, but it looks like their testing is now finally starting to catch up. So they're starting to get a real hold on what's going on. And I've heard their economy is being just obliterated right now, and they're trying to print a bunch of money to keep up with it. But apparently, all the money they're printing is actually ending up in the U.S. stock market, boosting the U.S. stock market, which is crazy because all these countries are going through economic hardship, but so it's kind of like, well, where should we put our money as investors, and the US economy is the one that's looks to be the strongest, even though we're printing tons of money, we're faking all these numbers, but we're still strong compared to all the other countries. So all this capital is just ending up being thrown at the US. And so, I wouldn't be surprised if we start to see I think I've said this really early on, that I don't think this crisis will be over until we've seen some currencies collapse. And so I still think that's probably going to happen to a degree. And like I've said, the dollar will probably be the last one on that list for reasons that I just said. It's the least dirty shirt in the laundry, as people would say. Uh, Money tends to rush towards the dollar as a safe haven, just because it's a little bit safer than all the other currencies out there. And South Africa as well. They're actually number 5 in total cases, ranked number 5. And I feel like they kind of just quietly moved up that list, and boom, now they're there, getting 13,000 cases a day. They have 360,000 total. Let me see. They've got 60 million people in South Africa, so actually pretty significant size. Let's see, cases per million, they're at 6,100. So they're at about half of what the US is with cases per 1 million. So yeah, we'll have to look into what's really going on in South Africa. It looks like their deaths is fairly low at 5,000 total, which is significantly lower than in the US per million. We have 433 deaths per million. They only have 85 deaths per million. So likely they're doing what a lot of countries are doing, which is not keeping track of the deaths very well. And, of course, Mexico and Brazil both being hit really hard as well. Spain and Italy seem to continue having things under control, and the UK is still trying to catch up. So that being said, what I alluded to earlier on just a minute ago was what state patients are really in when they're considered recovered, which I know here in Utah we're counting people as recovered just after 3 weeks of being tested. As long as you haven't died yet, then you're considered recovered. And we're starting to see a lot of this data come out more and more every day. We're seeing about how patients, even with a mild case of COVID, can still end up with some sort of permanent damage. So let me jump right into this article. It says scans reveal heart damage in over half of COVID-19 patients in a study that was recently done. A study on heart scans of COVID-19 patients has revealed more than half had some form of damage. The study involved 1,200 patients, of whom 813 had been diagnosed with COVID-19 and 300 were deemed probable cases. The participants were from 69 different countries. They each had an echocardiogram, a type of ultrasound scan for the heart, between April 30th and 20th. Of the total 1,200 patients, 667 had abnormalities in their scan, and 1 in 7 participants had what researchers described as severe abnormalities, according to the paper published in the journal European Heart Journal Cardiovascular Imaging. On average, the participants were aged 62. So so 62 is the middle. So there was some young, some old, and 70% were male. 60% of the scans were performed in a critical care setting, such as an ICU unit, while others were carried out in general medicine settings. Some 54% of the patients had severe COVID-19. So about half of them had a severe case, while the other half were either asymptomatic or just not severe. So I think down here, those with abnormal scans were more likely to be older and have certain underlying heart problems, so that makes sense. But after the team excluded patients with existing heart conditions from their analysis, the proportion of abnormal scan results and those with severe cardiac disease was similar. So that suggests that the issues that they're seeing in the scans were actually related to COVID-19. So this, and Chris Martinson actually went into this study a little bit deeper. So I kind of gained my trust into it, because obviously we're seeing tons of studies come out, and who knows which ones have some sort of ill intent behind them or which ones are true. But yeah, I think this is obviously a pretty small study, something we're gonna have to see more of in the future before we can really jump to any conclusions. But for me, I'm just marking this in the list of one more reason why I want to just avoid it altogether. Yeah, it can definitely be a pretty bad thing, and probably several years from now we'll have a much better idea of exactly what this can do to people. I know it can cause a lot of heart or a lot of blood clots and other organ failures. It hits you on all different fronts. So yeah, I definitely want to avoid it. And
Yeah, I've heard about brain clots and yeah, blood clots in the lungs, and yeah, definitely a lot of like weird stuff and like weird rashes and just like stuff that like lasts afterwards.
I actually heard, and this was from Chris Martinson too, so I'm like, it might actually be true, but apparently some people are reporting like lower sperm count and also shrinking testicles.
I'd hope not. I'm definitely avoiding the Rona.
Yeah, that'd be pretty demasculating for a lot of people.
Mm.
But I'll jump over to this other article here. This is some more depressing stuff. So we're sticking onto a lot of depressing news here on this show.
Yeah.
But I like to just kind of tell it how it is. And I think this is a pretty serious thing, especially considering this article I'm pulling up now here, which suggests that maybe the antibodies don't hang around that long. And as soon as you start thinking about that, I was talking to one of my friends about this yesterday. Then you can really start to get hit by how serious this might be if we don't get some sort of immunity to it over the years, and this is just becomes like another common cold that circulates, except for it's much more deadly. And it really kind of shows what we're up against here and how big of a problem this is for our scientists to solve. So the article here says immunity to COVID-19 may not last. This threatens a vaccine and herd immunity. How is the world going to go back to the days when we could grab a coffee, see a movie, or attend a concert or footy game? This must be in a different country. I don't know what a footy game is. With yeah, oh yeah, something like that. It's from the article is from The Conversation, so I'm not sure exactly who does that, but opinions suggest there are two options: an effective vaccine or herd immunity via at least 60 to 80% of people becoming infected. Either one of these options requires that people become immune to SARS-CoV-2, the coronavirus that causes COVID-19. An important new study released online this week could have a large bearing on how our future looks in 2021 and beyond. It suggests our immunity to SARS-CoV-2 does not last very long at all, as little as 2 months for some people. If this is the case, it means a potential vaccine might require regular boosters, which when I hear that, and then I kind of go into the conspiracy theory world, it's like, well, because a lot of people are really skeptical that this whole thing might be some, so that they can sell a bunch of vaccines or possibly put some weird stuff in you through a vaccine. And if there is any validity to that conspiracy, then this would be the perfect virus for that, something that requires regular boosters to stay viable. And also, I've heard that there's maybe some talk of literally putting in some sort of chip or something that slowly releases it. And so as soon as I hear that, I'm like, oh my God, nobody is going to be down for this if we end up having to go that route.
I mean, even my mom has said that she's not interested in going and getting the vaccine the first time it goes around because of the very fact that she's not sure that it's going to be the right thing. I mean, I don't know if it's maybe because we're conditioned to the first of anything that comes out just isn't always the best, whether it's software or whatever it is. But yeah, she's said flat out that she wouldn't get the vaccine because of the very fact that she doesn't think it'll work. Or that there could be some heavy side effects to it that we're not aware of. And because of on top of that, because of the fact that they're pushing getting a vaccine out so quickly, that they may not be doing the proper testing that needs to be done. So I mean, yeah, the whole idea of having a vaccine come out, sooner than later, and also, like, is a vaccine really the answer, or is it just like you mentioned earlier? This could just be another flu or cold that goes around that's a bit more deadly and spreads a lot faster than the two of them. That maybe we'll get to a point where we're able to treat it better, or maybe we'll get to a point where we can catch it sooner. Um, in people, and then start administering things that will prevent people from ever even having the symptoms that would cause any kind of damage to their bodies in the first place. So, and that might not necessarily have to be a vaccine, but just something that we could use. So, yeah.
I don't know if I'd be confident
Just
getting
a
a
thought.
vaccine personally. At least not for another 12 months or so.
Yeah, a lot of people are probably in that boat. It definitely makes a lot of sense. I mean, yeah, myself, I would definitely not be the first in line. That'd be a really tough choice. I got to be honest. I don't know exactly what I would do in that situation. Yeah, especially reading all the stuff we're reading now, that it probably is going to need more boosters in the future. So really, that means getting it would only just give you like a 2 to 3 month window. That's if it even worked, and if it didn't have some weird side effects that affected your life negatively in other ways. So continuing on this article here, it says antibodies are an important part of our immune system that mainly work by physically binding to virus particles and stopping them infecting cells. They can attach to infected cells to induce cell death in some cases. We have T cells, another part of our immune system that is much better at recognizing and killing virus infected cells. But for COVID 19, antibodies are important in the lungs because T cells aren't good at getting to airways where the virus first invades. So a little bit of a side point here. Chris Martenson made a whole episode on T cells, and I was kind of half listening to it. But what I took from it was apparently it seems that if you get a different type of coronavirus or a common cold or something, apparently there seems to be some evidence coming up that you may actually have a better time with coronavirus if you had gotten a different type of coronavirus recently. So, and it has something to do with these T cells. So that's something we'll be keeping an eye out for. So it sounds a little bit undetermined at this point, but there seems to be some evidence suggesting that. So maybe that could be some route that we look at it in fighting this one way or another. The newly released research from Katie Doers and her team at King's College London looked at how long the antibody response lasted in people who had COVID-19. It has been submitted to a journal but hasn't been peer reviewed, so it must be treated with some caution. Of the 65 patients studied, so it sounds like a pretty small study, 63 produced an antibody response. The important measures in the study relate to how good the response is. This is measured in the lab by putting patients' blood serum together with infectious SARS-CoV-2 virus and seeing whether the virus can infect cells in the lab dish. This is called a neutralization assay, and here the results were good. Around 60% of people produced a very potent neutralization response that stopped the virus growing in lab cells. Finally, the researchers measured how long the antibody response lasted. This is the most important data. Unfortunately, antibody levels began falling off after day 20, and only 17% of patients retained a potent level at day 57. Some patients completely lost their antibodies after 2 months. This suggests our immune response to SARS-CoV-2 may be lost much faster than we might have hoped. and people might thereafter be susceptible to reinfection with the virus. So, yeah, it's some pretty depressing stuff there.
Yeah, and I mean, that's kind of was like my expectation is, it's this new virus that's hard to fight. It's one of those, I don't see it's just like the flu. I feel like, if we don't get it under control and find some sort of vaccine and some sort of way to manipulate it every year, then this thing's just going to come back every year with a vengeance.
Yeah, or it might not even really subside like at all. It might just be one constant wave just constantly coming through, because if people are only immune for like 2 months, then that means basically there's always going to be somebody out there that's susceptible to it. And I've heard some virologists and stuff, epidemiologists, talk about like their biggest fear, and apparently like this type of thing is exactly what they feared, where it has like a reasonable death rate, it's extremely transmissible, and there we don't build an immunity to it.
Yeah, this could be something that isn't seasonal like the flu. I don't think colds are really seasonal. The common cold, but I mean, we've definitely not seen it. The only change that we've seen with COVID from when things were ramping up in the beginning to now is that the only thing that's consistent is that things dropped and started going down once we did a quarantine, and once we started like really locking down on social distancing and all that kind of stuff. It's just growing again because we've opened everything up again. And not everything, but a significant number of public things have now been opened to, and people aren't following the proper precautions to a point where it's not helping. Um, and there's so much controversy around wearing masks too that it's just wild. I, I'm I think a good like example of some of the controversy that's coming around it is, again, I'm going to bring up my mom again, but we talk a lot. She's a teacher, um, and she was telling me the other day about some of the uh, regulations that they were putting on teachers in classrooms and things like that as they open up schools. Um, and possibly providing teachers with face shields rather than face masks, but that if they're wearing a face shield, they have to be a certain distance away from their students, so that like there's not anything that can pass under the face shield to get to them, or vice versa. All kids have to wear a mask all day long, which is a joke. If you have kids or know about kids wearing a mask, like keeping them to wear something like that for a significant period of time is ridiculous. And then like having a safe spot in the room that's got a 6 feet parameter around it where kids can go to take off their mask for a short period of time. The state even released the like exemptions for specific people that may not have to wear masks for specific reasons too. So it's like some people are going to be wearing masks, some people aren't going to be wearing masks because there are some health restrictions to wearing a mask. It's like, I don't know, like I wear a mask. I do when I go out and I'm in a public place, but like um it's just, it's wild that all this stuff is coming out of like, should we, shouldn't we, what's really going to stop the spread of this other than just sitting in our houses, which also isn't a good um thing to go about doing, because people need interaction with each other. I genuinely recognize that, but we have to find out the best way that we can go about preventing the spread and hurting other people when this is something that potentially may never go away. I don't know what that answer is.
It's it's a long-term adjustment of adapting, and we as humans have come a long way from making the wheel and making fire and all the above. Like I give ourselves some credit when when it goes down the line. We've learned to adapt. We've made airplanes, we've made cars, we've gone above and beyond. We're talking right now and recording it, and none of us are even looking at each other. So when it comes down to it, I mean, it's I feel like there's going to be some sort of social. There's definitely going to be some sort of social interaction loss, but in the long run, I don't see it, having a crazy effect. It's just going to be one of those things that it's an adaptation. Not only are children adapting, but adults are adapting. Everybody's just trying to figure it out. Nobody's just, totally okay with it. And it's kind of like that shock factor. Like, okay, you got to let it do what it's going to do. And from there, we'll learn from that. We got to learn from the mistakes or learn from all the random chances we take. I mean, I feel like it's going to be really dumb, but they'll open all these schools up that are going to open, and all these kids are going to attend. And, in a month's time, we're going to have outbreaks, and then we're going to have pissed off parents and teachers, definitely teachers, and they're going to fucking go on strike.
Yeah.
Or they're just going to walk
There
out.
has been there was a news article I said and saw by KSL the other day though that I shared in our group chat that talked a little bit about how schools, or there have been announcements that they're going to stop. It says millions of kids told full return to school in fall unlikely. That was KUTV. So 2 News. I didn't get a chance to really read it, but it looks like it's something from the Associated Press, originally written out in Florida. But yeah, there's a possibility that kids may not be going back to school, and there's hardships on both sides. Sending kids back to school puts them in danger of the virus as well as teachers. We kind of talked about this a little bit on the podcast last week, but just like any other bug that goes around a school, a lot of people catch it, and you know, it's just a thing kids bring home. Everybody gets sick again in September and October because everything that's been stewing around at everybody's home over the summer gets now spread out to everybody at school, and then kids going to and from school. I mean, it's bound to spread. There's no sugarcoating it. Um, but the other side of it too is that a lot of kids don't always have the resources at home to be able to get on the Zoom calls and be in contact with their teachers. A lot of households only have like one computer, and is that a computer that can even like sustain the ability to connect to Zoom? You have poor communities where some households may not even have internet to be able to connect to the um, and connect to their teachers and things like that. Like, there's still people that live that way, and it's unfortunate. It's something that it's a reality that a lot of people have to face. And how do we allow our kids to learn remotely without endangering them by putting them into school? It's a really difficult situation.
I've always I mean, I've been going over it a lot lately, especially when it comes down to just the whole school thing. And I'm like, okay, why not shut down the schools? How much does it cost to run a school? How much does it cost to run all the schools in the country? Okay, how much does it cost to send every kid home with a tablet and provide internet to all
Yeah,
these people?
that's
Probably a
fair.
third of that at least.
And again, you run into the issue of how many of these kids have accessibility to the internet. And in a state like Utah, you think about families that have 5 or 6 kids. How many households have the internet to have strong enough internet to be able to handle the um, the load of that many people accessing the internet at the same time? Let's say you have 4 kids in your household. All 4 kids need to be on school at the same time. and what kind of damper is it putting on the internet? Not that like they're going to be doing anything crazy. I mean, being on the internet for school can't be anything like being on the internet for gaming. But I mean, if you're on a Zoom call for a significant amount of time, what kind of bandwidth does that put onto your router if you've got 4 kids doing that at once?
Well, yeah, I totally get that too, and that's where I turn and take the Bernie standpoint, and I'm just like, well, it'd be cheaper to fucking provide free internet to the entire country at a high speed than it
Yeah.
would be to run all the schools and provide them with tablets. Like, it would still be cheaper.
Yeah.
Our education system
Yeah.
just drains money, and it goes to fucking nothing. It does not go to the teachers. It doesn't.
Yeah.
Students never really
Well,
see
and it
it.
doesn't go to better education either, unfortunately.
I remember our school in California, we had like a $25,000 budget that we had to meet. And I'm like, okay, yeah, why wouldn't we, do all this badass stuff and at least invest? We had fucked up bugs. Their library was pretty shitty. Nothing was the greatest. And they had to use it because it was allocated on outdoor stuff. So they used it all to just paint murals. And I'm like, okay, so you're telling me that that's where the tax money goes? Just they allocate it okay, you have to spend this much on groundkeeping, this much on this much on this. And then the teachers just get this little baby amount. I'm like, nah. If you were just to cut out the whole fucking school process and figure out a way that kids could stay home safely and even in that sense, with that leftover money that isn't going to the school system, take another third of that and help parents out that can't provide without having to go to work. Be like, okay, here, cool, take this many days off a week, we'll give you a $200 or $100 a day or something.
Yeah.
It's
almost as
ways
if
around it.
Yeah, it's almost as if we should have been using the last 20 years of our tax money and knowledge to maybe try and fix the education system that's so broken to make it so that we wouldn't be struggling right now at this point. But instead, we're having to fix it in the middle of a pandemic when we're going to be putting children's lives at stake by putting them back into school. This is a joke.
Oh, it's ridiculous.
It's sad. I luckily I'm glad that my son goes to daycare up in Logan, Utah still, and luckily it's not like a huge daycare, and they haven't really had too much of an effect on them. But I can't imagine how it's going to be. I can't imagine if my son was old enough to go to school and what kind of anxiety I would have over him having to go to school, and the potential for him to catch this thing. Because for me, my son's at risk. He has really bad allergies, to the point where if he were to get something like this, a respiratory issue would put him in the hospital for sure.
Yeah.
And my son has allergies year round. It's it don't go away. We don't know what he's allergic to, but doctors won't test him yet because he's too young. So that's fun too. But and the stress that other parents could be going through this time, of I need to work. I need to be able to allow my kids to have an education, but I also can't allow them to get sick. But I need to go to work to get paid. But
Catch 22.
Yeah. I was gonna say it, but I feel like I've said it too much.
Yeah, no, I'll get you.
Yeah.
Yeah, I really like that, paying for families' internets and giving them tablets or whatever. I think that's actually a pretty good idea. That could actually go a long way.
Or even just like a Google Chromebook. Those Chromebooks, they're pretty cheap too.
Screamed it into this on a Fox News article that was talking about kids going back to school in California and shit, or everybody was pissed because they weren't going to go back to school. And I was just like, well, look, here's the solution, and fucking threw it out there. And like all these people mad reacted to it because they were like, well, what's that going to do to the children because they can't interact with people? And I'm like, what's it going to do to your child when they have 104 fever and they bring it home and then your entire family's infected and grandma's dying and you're all on fucking life support? Like, Jesus Christ, like, let's just think logically about this.
Yeah. And social interaction is important. And I mean, personally for me, I understand in a way how that would feel, and the fact that I've been working from home for the past, like, what has it been since March, 4 months now. And I do miss going into the office. I miss having face-to-face interaction with my coworkers. And a Zoom call, 3 times a week, just isn't really, the best, but it's something. And interacting in some way is better than nothing. And if I think that even though our kids might be interacting and socializing in a different way than they normally would with school, it's whatever we can do that's safer is better than nothing.
Yeah, I definitely feel for both sides. It's definitely a really huge thing just deciding on this whole school thing, how we're going to handle it. It seems like no matter what we do, there's going to be some negatives, there's going to be some positives, and this whole virus thing has just been really unfair with the way that it's affected different people in different ways. I feel like I've kind of skated by pretty well without having to deal with too much of the drama. Like me personally, I don't really care too much whether the kids go back to school or not. It's not going to change my life too much. And even when they closed down all the businesses, it didn't really change my life too much. But for other people, it's just had this huge impact, totally ruined their way of life. Totally, had made them, a lot of people can't go to their job just because now their kids can't go to school. So it's a huge thing on that. So I think we'll go ahead and bring the show to a close on that note. I think I do want to do a little bit of a visualization here, just kind of imagine like where we're at really, because you did say like the one thing that we did that seemed to work on this is that we closed down the economy. And even though that things are kind of open up, we're still doing a lot to fight this. Most people are wearing masks, and everyone's aware that we need to be keeping distance. I just imagine what the world would, what the state of this virus would be if we completely stopped all of that. I mean, hospitals are overwhelmed right now, and we're doing a lot to fight this. So I think that shows just how far we have to go, because they've got sports closed down, they've got all these huge gatherings, festivals, concerts closed down, and I think this would be much worse, than it is right now if we were to try to go back to some normality. And I know it's pretty depressing to think about, but we probably got quite a long way to go until we can truly go back to where we just don't have to consider this virus at all, like back how it was. I know that seems so distant and so far away and so like almost impossible to get back to where we can literally just go about our day without having to think at all about a virus or coming face to face too close with somebody or being able to give somebody a hug or something. But I think we ultimately just gotta do what we gotta do at this point. So is there anything you guys wanted to say before we go ahead and close off the show?
I mean, just to semi-counter what you said, like, I mean, how you were saying it, how it doesn't really affect you. I mean, I have to look at it, half empty in a sense that if a bunch of kids get infected, they're gonna definitely make this virus like go crazy.
That's true. That thought did, as soon as I said that, it did cross my mind. Like it could still, creep up into my life
That's what I'm
somehow
saying,
if
man. Like,
infection rate went way up.
you got some little kids running around or somewhere, and fucking you just happen to be there, Especially just like at grocery stores, because I see so many kids running around grocery stores without masks on. It's ridiculous. So, I mean, just my last message to the listeners would be: wear a fucking mask when you're in public, and cover your mouth, wash your hands, do all the above. We'll get through this.
Yeah, I'm sure as humans we'll figure out something. And yes, definitely wearing mask. I know the CDC, like within the past couple of weeks, actually finally came out and said, yes, everyone does actually need to wear a mask. Because I know there's been so much back and forth on that, which has just been devastating to trying to get the message across. Because once you put across a false message, then now you have to fight against all of that when you now want to try and get out the better message. So that being said, I just want to thank all of our listeners for listening. I think we're almost about an hour, so definitely a long one. Hope you guys enjoyed it. Remember to hook us up with a like or a subscription to get all the latest from us, and we'll talk to you guys later.
Take it easy.